RAM itself stands for Remote Area Medical. So that's a national organization that was started by Stan Brock, and really started out doing expeditions to third world countries, and then a few years ago decided there was a need in remote areas in the United States in delivering healthcare too. So they're really focused on expedition medicine, of going to an area once and delivering healthcare, episodic care. The difference in Wise County is its size. It's gigantic. I mean, we'll probably take care of well over 6,000 patients in a weekend this year. And the other difference for us at the University of Virginia is that we're invested in this region throughout the year, that this is not one event for us.
It's a community environment. So we're not going to be in the hospital, it's actually going to be in a fairground, so it's going to be a totally different environment, which kind of adds a little excitement to it, I think, for me at least. Well, this week we've been training for a lot of the techniques and skills that we'll be using down at the clinic. A lot of it's pretty basic, but it's going to be determined by what the specific area that we go to is going to be using.
So actually during the event, they're taught and they learn. They get to do a lot of different procedures, and they get to present one-on-one with attendings and residents to a greater degree than they might get to in other clinical environments. They get to see patients right off the bat when they first present, so they really enjoy that. And they get to do clinical skills and a lot of clinical skills that they may not get to do as much in an environment like here in Charlottesville, where there's 140 medical students and 500 residents, and here the number of patients relative to the number of students and doctors, the ratio is a lot different.
I think that many times when you see patients in an academic center, you're taking the patient out of their environment and you're seeing them here in our environment, and sometimes it's easy to lose sight of where that patient's coming from and what the challenges are for them to receive health care. And when students go to the RAM clinic, they're actually working with a multitude of patients who have difficulty accessing health care for various reasons. It may be because of distance traveled, it may be because they lack a vehicle, it may be because they don't have health insurance so they can't afford to go to a physician, or that they have health insurance but it doesn't cover certain screening exams, or it doesn't cover for them to have glasses made or to have their teeth cleaned or a tooth repaired. So there's many different reasons why a patient may not have easy access to care, or that they live in a rural area and there's not a specialist available to them in their area.
You know, a lot of times when you know, in the media you hear about how the healthcare system is broken and all this, and you see all the negativity about what's going on with healthcare. You know, I want to go down because I actually want to work with patients, hand in hand, right, direct care with patients. And so a lot of these people don't have access to healthcare as a lot of Americans do, but you know, it's going to be direct care, and that's what I'm really looking forward to.